Welcome to Kids Considered, where two pediatricians discuss children's health topics of interest to parents in a podcast with new subjects considered every episode. I'm Dr. Lena Vanderlist.
And I'm Dr. Dean Blumberg.
And we're both pediatricians at UC Davis Children's Hospital in Sacramento, California. Okay, so last month, I read an article that was in the Journal of Pediatrics, and I have not been able to stop thinking about it. And there are certain things where I just kept coming back to it, I'm so disturbed by this. And I just kept revisiting it over and over. And so the title of the article is Pediatric Skincare Regimens on TikTok. And the authors were Dr. Molly Hales and Tara Lagu. They're both at Northwestern and a team of people. And really what they did in this study was they did a deep dive into trends on social media surrounding skincare for kids and teenagers.
So if this stuck with you, if you really can't stop thinking about it, I'm really intrigued about it. So let's review this study and why it's important for parents to be aware of these trends and the potential harms of these skincare products.
Yeah, and then we're going to talk to, or we're not talking to, but we posed some questions to our pediatric dermatologist here at UC Davis, Dr. Smitha Awasthi, some true or false questions about common adolescent skincare practices.
And then let's highlight what a recommended skincare routine may look like in this age group.
So let's start by highlighting the findings of the study. And really, it shocked me, but I guess I'm also not a parent of an adolescent. So what they did in this study was they made a TikTok account and they reported that they were 13 years old and they saved the first 100 videos from over 80 different content creators and looked at the themes in these videos, the products that were used. And really, popular culture refers to these kids as Sephora kids, which is the big box store that sells kind of expensive or brand named cosmetology products. And they call them get ready with me videos. So it might be a young child or teenager that's asking the viewers to be part of their morning or afternoon routine. And they're becoming really popular.
So the videos had an incredible number of views, an average of 1.1 million views. And the creators were young, with a third being 13 years old or even younger.
And what they found out was that most of these regimens were complicated. So the regimens contained an average of 6 products, and they were expensive, costing about $168. Another study that was separate from this one showed that children 12 and under in the U.S. spend $2.4 billion on skincare. The study was done in just 2023.
And the products themselves frequently had ingredients that could be harmful to youthful skin. The top 25 most viewed videos had an average of 11 potentially irritating active ingredients, and some had up to 21 ingredients of concern, most commonly citric acid.
Yeah, and 19 of the top 25 videos had at least one contact allergen, and that's most commonly going to be from fragrance or something called surfactants.
So what that means is that these products are more likely to cause an allergic rash and sun sensitivity for users, and especially young people because they have more immature and delicate skin.
Yeah, and I'm glad you brought up sun sensitivity because the authors of this study also found that a quarter of these videos, so only a quarter, actually recommended sunscreen as part of the skincare routine. The one product that we actually know is so important for young skin.
Yeah, wow, because, you think these videos could be used for good, instead of potential harm. So these are clearly alarming findings from this study. Let's explore some of these popular products in more detail and then also discuss what parents should be on the lookout for.
Yeah, so many of these products contain something called AHAs or BHAs, that's alpha and beta hydroxy acids. They're mild chemical exfoliants that are really designed to help remove that top layer of skin cells. And similarly, retinoids, which are used in some over-the-counter acne or anti-aging products, do a similar thing where they're kind of sloughing off or exfoliating the top layer of the skin. In us, older people that have aged skin And it might be okay, but and people that have been like not gone through puberty yet, their skin is actually thinner, and these products are too harsh and make their skin more vulnerable to sun damage and inflammation.
Yeah, and because these products contain so many ingredients with really long and complicated names, it can be hard for even dermatologists, let alone parents, to be able to differentiate what may be safe for younger skin or end up causing more issues.
Yeah. And these large skincare companies, they know their audience and they do a really good job of targeting ads to young people. If it's not through just direct advertising, through like providing the products to these, content creators or influencers. I have seen when I was preparing for this episode, like facial masks and cleansers that look like bubble gum and slime, and companies that are promoting like, oh, create a skincare smoothie with our products where you're going to buy like multiple products and mix them together. So they also have colorful packaging and use like, kind of cartoonish packaging to make it appealing to young kids.
Wow, this is kind of reminding me of when we were talking about vaping products, where they know their stuff, right? I mean, these are professionals. I don't think you can really overstate the power of advertising for young people.
No, definitely. And so that's why it's so important to talk to your child and adolescent about advertising and how to be a savvy consumer and, potential risks that are associated with these products.
Yeah, so some parents may be thinking, well, my kid isn't on social media, so they won't be influenced by these products. But we know that peers are some of the strongest influencers. So even if your child isn't looking at these on their own phone, they're likely seeing these videos on their friends' phones.
So we talked a little bit about that study and these trends that are happening. And so I think, like, honestly, the first thing is like talking to your kid, hey, have you been seeing these things? Or if your kid comes to you asking for like a specific expensive skincare product, you might be pause and be like, where's that coming from? Like, let's talk about this a little bit more. So what I wanted to do was reach out to our amazing pediatric dermatologist and ask her some of the questions that I get from teenagers in my own office about skincare and sort of like do a true or false. So I gave her a list of 15 common statements that I have heard from teens, and she was kind enough to answer them before me. Should we go through them?
Yeah. I'll ask the questions, and then you can give her answers.
Okay.
So the first question, teen acne is primarily caused by hormonal changes stimulating oil production, bacteria on the skin, and genetics.
Yes, this one is absolutely true.
Yeah, I remember that from our acne episode.
Yep.
Drinking water directly improves skin hydration and clears acne.
So this is kind of a mixed bag. So definitely increasing your water intake does help with skin hydration, which then can sort of like help with the overall appearance of your skin. But there are not studies that show that water alone can treat or cure acne.
Poor dietary choices like processed foods, sweets, and greasy foods can worsen acne.
So this is actually true. She said that there's a recent study that shows that increasing your vegetable intake can lead to improvements in acne. Another great reason to increase your veggies, and that foods that have a high glycemic index, sugary, processed sweets and foods, can worsen acne.
Oily skin, it's oily, so it doesn't need moisturizer, right?
Wrong. False. Oily skin actually does still get dry and irritated and might need an oil-free moisturizer.
Popping pimples is okay as long as your hands are clean, right?
Wrong. So clean hands do reduce the chance of getting an infection when you pop your pimples, but it does not change the fact that popping pimples actually increases inflammation and can actually increase your risk of scarring, which will then, be there for a long time, if not forever.
We all know that sunscreen needs to be worn on sunny days, but if it's not sunny, and then we really don't need to wear sunscreen, right?
Wrong. So a good amount of UV rays, up to 80% actually, will make it through cloud cover. So really sunscreen should be a everyday, no matter what thing that you discuss with your child.
There's evidence that cryo rollers or jade rollers help reduce acne, tighten skin, and reduce puffiness.
Have you even heard of these products before, Dr.
No,
Dean?
I have not, but I did look them up. I had not heard of them before.
So they're extremely popular on social media and other things. And I think, thankfully for our wallet, this is false. There is no evidence that these will help reduce acne, tighten skin, or reduce puffiness. So save your money.
You should use an exfoliant every single day.
Wrong. So a lot of teenagers think this should be part of their skincare regimen, but using it every day can be really irritating no matter the type of skin that you have.
Retinol is too strong, and so it should never be used by teens.
Yeah, so retinols are usually in anti-aging products, which obviously teenagers do not need because you are youthful. You have time
Right.
on your side. They're not necessarily too strong, but they're not needed on teenage skin unless in the setting of acne. And in those cases, using a prescription retinoid under the guidance of your doctor is the recommendation over using an anti-aging product over the counter that has retinol in it.
The more expensive the skincare product, that means the better it works, right? You get what you pay for.
Also, thankfully for our wallet, false.
The more products you use, then the better your skin will be.
Absolutely false. So we'll talk about regimens in the future, but these like crazy ones that have 6 or more products are totally unnecessary.
Benzoyl peroxide products will bleach towels and pillowcases.
So this one is true, and this is something that we always talk about because benzoyl peroxide is available over the counter, and it's one of our first line treatments for teenagers with mild acne. And so whenever I am recommending it, I'm also telling parents, make sure you buy special towels and pillowcases that are white, and that those are your teenagers to use.
Acne patches are effective in treating existing pimples.
So she actually said true. I was interested with this because I don't know if you've seen the young people with they have a star on their forehead or a little heart covering something. And she said that they can be helpful in that they can help treat the existing pimples and prevent picking.
Pore strips reduce the size of your pores.
This one is false. And I don't know if pore strips are as popular now as they were when I was a teenager, but we were always sleeping with this strip over our nose, and they are not effective.
Yeah, I do feel that was more popular in the past. What works for your best friend's skin will also work for you.
False. So skincare is very, tailored to your specific skin type and what you're dealing with. So depending on what your specific problems are is what your regimen should be. So just because something worked for your best friend's skin does not mean it will work for you.
Right. Everybody's different and has different skin and different needs.
Right. So now that we have reviewed some common truths and myths around preteen skincare and teen skincare, let's talk about what an appropriate skincare regimen might actually look like in this age group. And let's just start by saying flat out, if your child has not gone through puberty, they do not need a expensive or complicated skincare routine. So before puberty, oil glands are not active, and so the skin barrier is more thin, but it's also relatively easy to take care of.
For kids that have underlying skin conditions like eczema, psoriasis, perioral dermatitis, you can consult your pediatrician or dermatologist, as these are, they're kind of unique cases. Everybody's different. But for the majority of children, a basic gentle cleanser that can be used on their body and face is fine.
Yeah, and washing the face just once a day or when visibly dirty is also totally fine. For kids that tend to have dry skin, you might want to use a moisturizer after bathing or washing the face. And at this age, it's really fine to use the same moisturizer on the body and the face.
And most importantly, teach your young kids about the importance of sunscreen and sun protection. One thing we do know is that early childhood sun exposure plays a risk for skin cancers later. And that's why it was shocking that only a quarter of the TikTok skincare routines had a sunscreen, something that we know can really help children.
Definitely. So parents ask me all the time, what's the best sunscreen for my kid? And really the answer is it's going to be one that your child will use every day. Whether it's a stick, a spray, a lotion, you might have to try multiple before you find one that they like. There have been some concerns about chemical spray sunscreens safety because over time, like the risk of inhaling some of the particulates in young children or some of the other like chemicals that are used may not be the best. But if used sparingly, I wouldn't worry too much about. And then you might opt for something like a mineral-based sunscreen with zinc for the face or more of the everyday.
So generally, with all cleansers, moisturizers, and sunscreens, opting for fragrance-free is a good idea because fragrances are common causes of contact allergies, and they may result in rashes in kids with sensitive skin.
As young people start to go through puberty, then they start having more oil or sebum production, and this is when acne can start to develop. But honestly, skincare routines don't have to get much more complicated. So we have done an entire episode on teen acne a while back, so check out that for a lot more detailed information, but we can give some of the highlights here again.
Yeah, so your teen may want to use an over-the-counter face wash with benzoyl peroxide once a day, but ensure that the concentration is not too high. Somewhere between 2 and 5% is sufficient without irritating the skin.
Yep. Then they can apply a moisturizer with sunscreen, again, stressing the importance of sun protection, especially in acne, because this will help minimize scar formation.
And at night, they can use a gentle, non-medicated cleanser. And depending on the severity of the acne, they may benefit from applying a gel or a cream like adapalene, which is commonly sold as Differin, or a prescription cream from their doctor or dermatologist like retinoid or a topical antibiotic.
Yeah, all of the other regimens with these like different toners and serums and masks and exfoliants, it's generally a little bit of overkill and not helpful for the acne alone.
Of course, each person's skin is unique, and there are definitely cases of severe inflammatory acne that would benefit from physician or dermatologist involvement and using stronger medications when appropriate.
Yeah, but we really want parents to know after hearing this episode that skincare is not something that should have to break the bank or they should really just go into blindly like, oh yeah, let's go buy that slime mask from Sephora. And we are always happy to help provide recommendations and guidance when it comes to adolescents and their skin.
We hope that this episode helped shed some light on recent skincare trends for young people and give parents tools to talk to their children about some of the harmful effects of excessive or harsh skincare products.
We reviewed some myths and truths around common skincare practices in young people and provided evidence-based recommendations for age-appropriate skincare.
And we would like to thank Dr. Smita Awasi for answering some of our commonly asked teen skincare questions.
And you will find on our website the links to that study that we discussed, as well as more teen skincare tips.
And that reminds me of a joke.
Let's hear it.
Did you hear about the teen who won a lifetime supply of skin lotion?
No.
When she talks to her friends, she just keeps rubbing it in.
Haha. Yeah, I mean, honestly, I think that like it's part of being a young person to be curious about, trying these different things. And, you commented on how like comparing this to like when we did the episode on vaping and advertisements. And like, obviously this is way more benign than that. Like if a kid wants to apply like a slime mask to their face at like a sleepover party with their friends, I don't know. I think as a parent, I would say like weighing the risk of like, oh, my child may like their face might start to burn and they'd be uncomfortable, but maybe they had fun with their friends. It's probably not the end of the world. It's just not what I don't like. And I think why I kept coming back to this is like spending as much money as they're spending on it. The time that a child would spend applying like 6 products to their face when they could be like out playing or doing other things, it kind of goes along with the screen time and why I kind of cringe a little bit with that. So I think that's the important thing to think about. It's like, we don't want a 10-year-old to spend an hour in the morning doing a skincare routine. We want them to be like drawing and using their imagination and like, playing outside.
Reading a book.
All of those things are sort of what made me like just keep being like, whoa, this is not great.
That wraps up this episode of Kids Considered.
You can find more information on our website, kidsconsidered.ucdavis.edu.
Follow us on Twitter @KidsConsidered.
And Instagram @KidsConsidered.
If you have feedback on this show or topics you would like us to discuss in the future, we would love to hear from you.
Please call us. Our number is 916-915-3388.
Or email us at kidsconsidered@gmail.com.
Please rate us on iTunes or wherever you subscribe to your podcasts.
Thank you for listening, and we hope you will join us for our next podcast.
Kids Considered is sponsored by UC Davis Children's Hospital.